Hey everyone, Bridget over here at the AAFE Training Center. We are just going to treat my patient with some neurotoxin. So first, I am just marking my lateral borders of my frontalis, making sure she doesn't get that spocked brow appearance. I'm evenly spacing my dots just all around so that I'm able to treat the entire muscle. I'm making sure to stay a finger breadth above the brow to make sure we don't drop any brow or have any lid ptosis. Next, I'm going to find the tails of her corrugators and mark those along with her procerus and medial lateral edges of her corrugators so I can treat all of them. Lastly, I'm going to be marking up her crow's feet, always making sure to feel my orbital rim, making sure to stay about a finger breadth outside of that. I'm doing, an appropriate dose for her, which is over 4 different spots. I'm going to go in now and slip right into the muscle of my frontalis, which is pretty superficial on her. Once I'm in that muscle, I make sure to deliver my appropriate dose where I labeled my dots to be. And we're just going to continue all the way around our frontalis to make sure she has no abnormal movement in 2 weeks once it settles. The frontalis is great to treat if your patient really does not like their horizontal creases on their forehead. This is a great option for them. As I said earlier, I'm going to be treating all the way laterally. If not, she's going to get what we call a spocked brow, which is where the ends of her brow are basically raised. Some patients love this look. She personally did not want this. Next, I'm going to be treating my procerus and corrugators. I'm really going to make sure to isolate those muscles because I don't want them leaking into the eyelid, and I also don't want them leaking up into the frontalis, causing like a medial drop in her brow or even a lateral drop in her brow. I'll even keep my fingers underneath of my injections for a few seconds afterward, as you're about to see, to really make sure that that neurotoxin does not spread somewhere that I don't want it to go. Some patients will have really small corrugators, so you might only be treating a medial injection. But she personally was able to fit 2, even though her corrugators are on the smaller side. I'm really making sure to watch my needle depth here. I'm going to do 3/4 my needle depth for my medial corrugator and only half my needle depth for my lateral corrugator. The frontalis sits right underneath of those corrugators, so I don't want to drop her brow, as I said earlier. I'm always making sure to wipe up and away for wiping all of her dots off, just to ensure that none of that leaks down into the eyelid. Next, we're going to be doing her crow's feet injections, which really takes care of those horizontal lines that happen as we age when we, continue to smile over time. These injections are very superficial, so as you'll see, I'm really only just inserting about my bevel. And I slide right into that thinner muscle, so I'm making sure to treat all of her crow's feet, which actually go down close to the bottom of her eye. Some patients really like their crow's feet and they don't want to treat them. However, it is a depressor, so when we treat them, it doesn't do anything except help open the eyes more. So we do recommend, if people are getting neurotoxin for anti-aging reasons, that we do treat the frontalis, glabella, and the crow's feet. Thank you guys so much for watching, and if you're interested, get AAFE certified today.